11:04 Dr. Payne Show, 1-855-55-DRLOU, Dr. Lou, info at paincarecanada.com. That is the contact information, which we will give out for the next hour. How you doing, buddy?
Amazing music. Finally.
Awesome.
But you guys ripped me apart for everything, eh?
No, you're
in the Carrasco show, the car, the coffees, the music. I said I like Metallica.
Yeah, it's brilliant.
Yeah,
Greg is the biggest Metallica fan
I love
ever.
Metallica. I was watching them in July. They're the best.
Did you go?
Yes. Well, how would I have watched them?
How was it?
It was amazing.
Yeah.
Love it. Love Metallica. Love all kinds of rock.
Did you hear what Lars Ulrich said this week about drumming?
No. What?
Nah, not big on technique.
He's amazing.
He's right.
Yeah,
you play what the band needs. Screw technique. I'm not a technician. I love that guy. Talks
amazing.
too much, but he's all right.
That's okay.
So, update. What's been happening?
Lots of stuff. I actually liked that last segment of Greg's show with the complaints.
Complaint
and I'm
hour.
sure that a lot of listeners have healthcare complaints that I would love to hear. So if
bring
you're
them on.
listening this hour, let's continue what Greg Carrasco, the genius, has started, which is the complaint hour, because there's, I'm sure, all kinds of healthcare complaints. So give us a call.
Questions.
Let's hear them. Yeah, 100%. There's this is, everyone seems to think that our OHIP system, that this is the most incredible right that we have as Canadian citizens, and that everything about it is amazing. And let me tell you that there are a lot of issues within our system. But anyhow, we won't get into that. Let's wait for some people to call about the complaints.
But you did mention, and we've mentioned this with you've had Doctors Bergava and Gordon
yep.
on the show before, and they will be returning next week.
Yeah, next week. Yep.
And we were talking about that, and he says, I was shocked about this.
Yeah.
And he said,
I love this stat.
As far as the healthcare, like mirror for mirror healthcare system, the identical healthcare system.
Country.
Only one other country
Let's
has.
See. Don't even say it. Yep. Let's see if people can guess it.
People can call in and guess which country has the identical healthcare system to our brilliant system that we have in Canada.
Yep.
If you know what you think country it is,
one country.
Take a guess, call us, let's see if you can nail it.
Let's see if we can nail it. Yeah.
So what else you got going on?
So on that topic with Doctors Bergava and Doctors Gordon, with our knee clinic, which we've talked about a lot in 2018, so people suffering from acute knee injuries, this is a very, very important thing. I want everybody to call me with all of your complaints. But I do want to highlight something about the knee clinic. This is designed for people who have had acute injuries, acute meaning sudden, something that's happened within the last few weeks, okay? And what we're looking for is if you have some very concerning symptoms and signs that you're feeling, that you likely need surgery, okay? And there's a couple quick questions that we can go through that will highlight to me if I think that sounds like it's potentially surgical. Because the whole point of this system, of this knee clinic, is if you need surgery and you go the traditional route, there can be 6 months, 7 months before you're even in to see the right person. Forget the surgery. Before you even get to the right person. And all that does is delay the prognosis. Prognosis meaning how likely you are to get back to normal, okay? And the more time you waste with useless tests, things that aren't needed, all you're going to do is minimize how likely you get better. So if you've sustained a knee injury, something sudden, or you know somebody who sustained a sudden knee injury, give us a call, because if you answer yes to a couple of very important questions, we can get you in to see a specialist right away. And if you need surgery, you're going to be having that surgery right away. Now, I know surgery can sound scary to people, and a lot of people say, no, I don't want surgery. There are some things in the knee that happen that you don't have another choice. There's no alternative. Well, I shouldn't say there's no alternative, because there's always, you can do nothing. But you may not necessarily have, a good alternative, something that's going to be as good as the surgery would likely be. So I think it's very, very important that if you know someone, you've sustained something, give us a call. Now, if you don't have a knee injury that's acute, something that's happened, something that's a nagging knee injury, still give us a call. Right. You may not necessarily go directly to see the knee specialist, because there probably will be no benefit to that. But the way this system is designed is really to get in people who have a sudden acute knee injury that is likely surgical. We get them in quickly, covered through OHIP.
Yep.
That's it. Now, again, you may have something that is non-surgical, chronic condition. Equally, give us a call. We can still help, but you are not going to go likely into that system. But that's okay. You can still give us a call. You may still need to see a specialist, and I'll still send you to see Dr. Burgava or Dr. Gordon. And there's a lot of interesting things. Next week, we're going to talk about PRP, which is platelet-rich plasma injections, which some really, really, really good stuff. I'll talk a little bit about it throughout today's show, but if you're interested in that, you have to listen next week because these two gentlemen, they do this for knee complaints. And the research and the things they like that they know, some of the things that are so common, like people that get cortisone injections for the knee. Dr. Gordon did some review of the literature and did a presentation on this. There's no good evidence for it. And it's crazy how many people come see me and say they've had multiple injections of cortisone. And there's a risk to having those steroid injections. There is a risk long term. So anyhow, give us a call.
416-870-6400, star 640 on cell. Taking your calls, your complaints, your queries about your health. Kyle, hey, pal.
Hey, gentlemen, is the country in question North Korea?
Yes, that's the one. How about
didn't even
that,
make this game fun. It was so easy. First, yes, it is. It's North Korea.
Hey, while I'm on, Dr. Nally, you assessed my knee last springtime. I think it was around March or something.
Okay.
Can I just give you guys an endorsement?
Yeah, of course. Sure.
Dr. Nally went all over my knee, and at the end of the assessment, he gave me a couple of very simple exercises. I've been following them, doctor, and I can tell you they're working, and they're very non-invasive, and it's really simple to do the seated knee lift.
Kyle, I see a lot of people, so remind me a little bit because I'm interested to remember what it was. If I've given you exercises and that was all the recommendation was, I'm going to guess, based on my memory, that I probably diagnosed you with like a patellofemoral pain syndrome, something with just a tracking issue. Is that a good guess?
Yeah, it was something along that. I've just been banging away on it unconsciously for a long time. And it's something I've noticed, Dr. Nally, a lot of people lose faith. It takes a long time
100%.
to get your faith back.
Yeah, and see, Kyle, the endorsement isn't just to me. I want to give you an endorsement as a patient because this is a big thing. We give patients exercises, things to do. They don't do it. They come back months later and they say, I'm not better. Yeah. Well, what do you expect? You're coming to me for my professional advice. I'm going to give you that advice. If you're like Kyle and you follow through with that advice, then you're going to get the outcomes that Kyle's getting. If you don't follow through with it, you're likely to get worse. So, Kyle, I think, good on you that you took that advice, that you do it. And another important thing that people need to understand, and I think you get this, Kyle, is sometimes the issues don't ever disappear. This is likely something Kyle's going to have. But if he does those exercises, he does the right things, he's going to manage it, and it's not going to affect the quality of his life and the things he has to do day to day.
Kyle, appreciate your call and your calls coming up as well. Hang on the line. We'll get to you. 416-870-6400, star 640 on cell. Got something to talk about, complain about, got some questions for Dr. Lou. He's here right till 12 o'clock. Dr. Payne Show on Global News Radio, 640 Toronto. That is the number, 416-870-6400, star 640 on your cell.
Great job on the music, Jody.
Yeah, Jody's the man.
Some Led Zeppelin, too. I'm a big fan.
It's like a restaurant.
I know, right? Coming right up, sir.
Don't forget to tip you. Billy and Barry. Hey, Bill.
Hey, what's going on?
Nothing, pal. What's going on with you?
I just wanted to ask the doctor, a while back in May, I had what they call a radical nephrectomy.
Okay.
I had my right kidney removed.
Yep.
They'd found a tumor of renal cancer on there.
Okay.
Now, since then, they took it out. It was all that. It seemed fine and everything. And recently I went for a CAT scan and through my urologist, she said, well, everything looks good. And she checked out all my flow and everything was fine. And then I get an appointment with a nephrologist, and I phoned back to say, did you guys, find something wrong or something? And they said no, and I'm just trying to understand why I would need that.
That's a good question. Again, I'd have to assume a lot of things here. But if you did have a kidney removed, you likely, it makes sense why you would continue to have to see.
And I am seeing my urologist. I even recently had a CAT scan, just an update, so she could see if everything was doing what it's supposed to, working right, and I had all my flows checked.
And everything was good?
That was my complaint. It just seems sometimes that a lot of this stuff is just rehashed. Like you go to a specialist and he basically just reads a few things. Looks and basically tells me exactly what the other guy said.
Yeah, no, and I mean that's a good point. I think a lot of times too. I mean, when you look at someone who's like a urologist, they're specialized in a certain extent, but then there's even more subspecialties within urology, right? And so sometimes people will want to defer to even more of an expert just to make sure that their opinion is correct, right? So that they're not mismanaging you. So I'm not 100% sure, obviously, why you would have gotten referred to that. But I mean, the other thing that I encourage people...
But it doesn't mean maybe they're seeing something and they're just not telling me.
Well, I don't know. I can't comment on that, right? I mean,
usually do stuff like
no,
that.
You should never withhold information from... I mean, someone may see something and be unsure. So the example could be, let's say I take an X-ray of someone's hip, for example, and I see some type of, there's certain findings that could suggest that maybe there's bone cancer, but I wouldn't be able to tell someone, hey, I see bone cancer here, because now that needs to go to a biopsy. So
I did. I went to a bone scan. And
correct.
Can I ask one other question?
Sure, yeah.
It turned out, even though they got it, that it spread into my lung, this renal cancer.
Right.
And I had little nodules in there. So now I'm on a non-chemo oral thing called Votrient.
Okay.
I find it like I have no strength.
Okay.
Really quickly. Like I haven't done much for the last year, so I know I'm out of shape. But really quickly.
Right.
Is that sort of a side effect of those kind of drugs?
I'm going to assume yes, but again, I don't specialize in cancer treatment and things like that, so I'm not 100% sure. What I would say is people will often have a lot of these questions. I think it's very important that you ask your doctors all of these questions. You know,
I actually have. I just thought I'd see what you had to say.
Yeah, I'm not sure. Yeah. I would likely imagine. I mean, one of the most common side effects of all medications almost is to some extent that they affect like your ability to be cognitively aware, right? Because they're going to work on a lot of things. So, I mean, something as strong as some type of oncology drug, yeah, absolutely. Yeah. I'm sure it makes a lot of sense that it would do that.
It's a Panopanzib is the other name of it.
Right.
Pretty strong stuff.
Yeah, for sure.
Yeah.
Okay, thanks. That's
no problem.
Thanks, Bill. Appreciate it. We'll got one more. We'll take a break. Got one more? One more? Okay, we'll take one more. We got Jack in line. Hey, Jack, thanks for hanging on. How are you? Hey, Jack.
Jeff? You talking to Jeff?
Oh, okay. I got Jack here on my call screen. Okay, Jeff, go ahead, bud.
Yeah, hey. Hi, Dr. Lou. First time calling in. I listen to your show every Saturday.
Awesome. Brilliant. Thank you.
Yeah, I mean, anyways, thanks so much. Great advice. So listen, I'm a 51-year-old guy. I'm I'm a $155. I'm pretty physically active.
Mm-hmm.
And basically, I have this severe, it's in my hip. It seems like it's in my hip. My sister says it's my glutes.
Okay.
But basically, when I sit down, I'm working at the desk or, I'm watching TV or whatever, I get up.
Mm-hmm.
I can't even move, severe pain.
Right.
But I can run 10 kilometers on the thing with no issue. So
okay.
I just I don't know if my age, I need a hip replacement, or it just kills me. It's just on my right hip. Yeah.
Okay. And so again, let's try to. A lot of times people will say hip. So let's try to. Is it on your butt, like in that area, or is it to the side? Or is it in the front, closer to the groin?
To the side. It's right to the side. Yeah.
To the
exactly.
side.
And so I can't even it's so stiff when I watch TV, like watch the hockey game or get up or whatever. It's just like crazy.
Yeah, I mean I can tell you one thing, and I'll try to be kind of general with this because this isn't always consistently the case. But when someone says to me, if I do nothing, I've got issues or I've got pain, this is sore, et cetera, and then when they say to me, but hey, if I move around, even like you've said, I run, I feel better. That to me suggests when muscles warm up and work properly, it tends to suggest that there might be a muscular issue that happens when you're not moving around. So there's enzymes in your muscles that function at optimal temperature. So a lot of times that's just some type of muscular issue. But I mean, could it be arthritic? Could there be something? Yeah, absolutely. I think it's worthwhile. Come in, have an assessment with me. We'll take a look at it. I mean, hips are one of those things that, I set aside an hour for everybody, but Sometimes people come in with hips. I can do 1 or 2 tests and be almost 99% sure what's going on. Like, there's the hip is like, I understand it so well. I don't want to big myself up here, but yeah, come on in. Let's take a look at it, because managing the proper way is important.
1-855-55-Dr. Lou, DRLOU. Make that call, Jeff, for it's info@paincarecanada.com. Lots more. The Dr. Payne Show is on the way. This is Global News Radio, 640 Toronto. It is 11:26. Your calls, your complaints, your issues with our system, with healthcare, with your own personal healthcare. Give us a call right till 12 o'clock. Or me.
All the complaints, lots there.
Nothing.
Sure. Yeah.
Nothing. Unless my wife calls in. Oh, hey, Dan. How are you?
Good. Thank you.
What's up?
Question. I'm a 53-year-old. I've been very active over the years, playing many sports, playing a lot of competitive squash right now. I've had 6 knee surgeries, so I'm still going at it. And the question I have is, over the last couple of months, my knees are fine over the last 3 or 4 years. My last surgery was 2008. Beginning to get a little bit of arthritis, obviously building up, but the braces I buy, those really fancy, expensive ones, have done a really good job.
Right.
But the question I have is, I've had a Baker cyst develop at the back of the left knee.
Okay.
And it hasn't caused any pain. It doesn't cause any lack of mobility or anything right now. So I'm wondering, do I just ignore it? Is there a way to treat it so that it'll slowly go away, or what?
Yeah, I mean, it is possible to drain them. The reality about a Baker cyst is that oftentimes, as you mentioned, that you have some mild osteoarthritis starting. As that happens, what ends up happening, a Baker cyst ends up forming because the synovial fluid within the joint, as the joint space diminishes, that fluid starts to leak out. That's why people that have severe osteoarthritis over time develop a lot of swelling. But prior to that, as it starts to slowly leak out, it'll form a cyst, and it's often in the back of the knee, just called a Baker cyst. If that cyst is not pushing on anything, like the sciatic nerve runs behind the knee. If it pushes on the sciatic nerve, it might create an issue. If it's not pushing on anything, it's probably not going to be an issue. So I would say I would leave it. And if it does become symptomatic, then that's something to be concerned about. I think, you bring up an interesting thing that I wanted to talk about anyways, which is the PRP injections, the platelet-rich plasma. Some of the best research for PRP is in the knee, and it's for people such as yourself that have mild to moderate osteoarthritis. It's actually not very effective for severe arthritis, but people who are suffering from mild osteoarthritis, that chronic nagging knee pain that happens just due to wear and tear, there's actually very, very good research to support that, 3 months until a year after the injection, people continue to improve. And it's a great way for people who will eventually need knee surgeries or knee replacements, because again, you'll hear from Drs. Brugava and Dr. Gordon next week that 84% of knee replacements last about 15 years. So you're at 53. Now, you don't need a knee replacement, but let's say you get to about 60 and you do need a knee replacement. That potentially means that at 75, you'll need another one. So I mean, I would want to minimize how many of those things I would want to do. And so what Dr. Brugava's and Dr. Gordon recommend is, if you do something like a PRP injection, it delays it delays the time until you'll have to do that stuff, because it's not going to slow down the degenerative process, but it is going to help with the inflammation, and it's the inflammation that creates the pain. So, I mean, it's something...
I'm probably about 10 years away from being able to do an actual replacement. I'm too young right now.
Yeah, no, absolutely. I would not recommend it at your age.
Yeah.
But give me a call. Let's discuss if you're interested in the PRP. With Drs. Brugava and Dr. Gordon. I think it's a worthwhile investment for people who have that type of issue and want to remain active, especially like yourself, and keep. And I actually think you being active is part of the reason why your pain is not so severe, because people don't realize that as your body starts to break down, actually staying at a level of activity helps it to maintain its pain levels. It's once you stop doing everything that things actually get worse.
Yeah.
So
okay, thank you.
Yeah, no problem.
Thanks, Dan. Again, 1-855-55 Dr. Lou, DRLOU. We'll take Colleen after we take a short break. Your calls as well, 416-870-6400 *640 on cell. The Dr. Payne Show, Global News Radio, 640 Toronto. 11:33, Dr. Payne Show. info@paincarecanada.com. Get that consultation happening free of charge. 1-855-55-Dr. Lou, DRLOU. Colleen, good morning. Thanks for hanging on. How are you?
Good morning. Thank you so much. I listen to your show periodically, but I do love your show. I do love listening to you. One thing that you said to one of your older clients was really helped my mom. So I wanted to thank you for that.
No problem. Thank you.
So my daughter, she's 17 going on 18. She's an elite gymnast for Canada.
Mm-hmm.
And she trains 30 to 35 hours a week.
Yep.
2 years ago, she had a stress fracture in her back. Everything checked out fine. We've had MRIs done with and without the dye. We've had CAT scans done. We've had x-rays done. We've had all kinds. She goes for chiropractor twice a week. She goes for physiotherapy once a week, and she goes for acupuncture once a week.
Right.
And with all that, she still is in pain.
Okay.
She refuses to quit.
Mm-hmm.
Which I think is admirable.
Yeah.
It's right at this point, it's just she's trying to find a scholarship right now in the States. So
Mm-hmm.
for her, it's just, kind of traveling on. But for me, I just don't want her to constantly be in pain. So I'm wondering if it's something deeper. I'm just wondering if it's something maybe she has a high amount of something in her body. I don't know.
Well, where was the stress fracture? Do you know exactly?
It was L3, L4, I think.
Okay. Do you know what part of the vertebrae?
No, that I'm not 100% sure. I know it was right down where the handlebar meets the.
Pars defect. Yeah, exactly. It's the most common thing in gymnasts. Actually, a lot of the times, in all honesty, a lot of times when we see, let's say, an older patient. And we end up taking an x-ray, we'll see that as an incidental finding where we'll say, you've got some type of a pars defect here. Did you used to be a gymnast? And a lot of times the answer is yes. So it's actually quite common. I guess what that means, in my opinion, is, the pain levels that she has may not necessarily be related to that injury, because there's a lot of people that have that type of an injury and don't necessarily have pain. Now, pain is a very complicated thing. And if you've listened to the show on and off, once you get into chronic pain, things that are going on more than 6-7 months, there's a learned aspect behind pain, right? Where it's a neural pathway that's being developed, because it's the same thing as, your daughter now, when she first started to practice the gymnastics, she had to think of, about every single little thing. Now her body's so good at doing it. And that's because our brains are so good at making things automatic, because it would be impossible for us to have to think of everything. Pain works the same way. A lot of times when you experience pain in an acute setting, it's a constant signal going back from your whatever area, in your daughter's case being the low back to the brain, and then a signal being sent back, and do that repeatedly, millions of times over even just a day, over months. A lot of times it's almost impossible to break that signal. So, I think it's worthwhile for me to assess your daughter to see, could it be something else? Potentially, I don't know, but it may not necessarily be related to the other things. The other thing that I would say that sometimes I recommend, and I don't want you to take this as the recommendation that she should do without me assessing her first, but sometimes people overtreat as well. So if she's doing a million different things, physio, chiro, acupuncture, et cetera, all of those things to an extent are trauma. They're controlled trauma with a professional, but they are still trauma. And so sometimes the recommendation is just discontinue. Do some rehab exercises, some very specific things on your own, but discontinue the passive things, because, the other thing is, if you continue to do it and it's not working, all you're doing is building an adaptation to those things. And so if something does go wrong and you need that type of intervention, your body's adapted to it. But again, I'm not telling you to do that, because that's a recommendation that I would have to assess her to make that recommendation, to be sure. But just in generally, sometimes that is sometimes the problem, the over-treatment of things.
Sometimes less is more, right?
That's what I was wondering, because she has two different chiropractors. She has one chiropractor that's physiotherapist as well.
Yeah.
And then she has a chiropractor that puts her, because her hips come out of alignment all the time. But she's twirling in the air like 30 hours a day.
Yeah,
so.
and do the two practitioners, do they communicate with one another about her case?
No, they don't.
Yeah, and see that's one of the big things that I've done is I've tried to build a team of professionals that communicates on cases, because I mean, you can be doing one thing in one place and someone's doing another thing at another place, and they may actually be offsetting each other. Now, again, that may not be the case in your daughter's particular issue, but I see it also often where I see people come in and they're like, and I ask them, they tell me they've got something. I say, okay, what are you doing? And they say, well, I'm going over here and I'm doing this, and then I'm going over there and I'm doing this. I'm like, yeah, but that makes no sense. One is
pushing,
working on
pulling.
this. Yeah, exactly. It's a tug of war for no reason. But if you want, bring your daughter in, give me a call. We can set up an assessment and go through it, assess her properly, see what's going on. And again, my job is, I'll make the best recommendation that I think the research and my clinical experience has to offer.
Colleen, that's 1-855-55 Dr. Lou, DRLOU is the number. Paul, we'll get to you before break. How are you, pal?
Pretty good. How are you?
Good, man. What's going on with you today?
Well, I've been having bad knees for about a decade now. I got arthritis and, cyst and bone spurs and meniscal tears. And I just saw a specialist, and I've had surgery on them a few times, but, I'm in a lot of discomfort, and I'm on meloxicam so I can walk.
Mm-hmm.
And I'm very active, I'm in construction, so I'm on my feet all the time, but I'm in a lot of discomfort. I don't know. The doctor said the surgery wouldn't really help.
What surgery would that have been?
Yeah, orthoscopic.
Okay, and as the doctor said, do you have severe osteoarthritis? Is that the issue, or you don't know?
Well, the meniscal tears, in my opinion, is the ones that are really causing me a lot of grief.
What about in the doctor's opinion?
He just said that, because I've had surgeries before, he said that it would probably tear again because I'm so active, and he won't do a knee replacement because I'm so active. And I got both knees, but both the same kind of problem. So I have, I got braces made, custom made, and they're not really helping that much.
Okay.
They were thousands of dollars, right?
Mm-hmm. So what's your question, Paul?
The question is the meniscal tears, they hurt so bad. Is that something normal?
Well, I don't know that you can know for sure that it's the meniscal tear that hurts, right? There might be a combination of things going on. So, I mean, if you've had it repaired multiple times based on what you're saying and you still have issues, then I don't know that a person, even if it was me and I had multiple issues going on in the knee, because if you've got bone spurs, that's osteoarthritis. I'd be interested to know to what level is the osteoarthritis. I'd also be interested to know, what does your work entail in terms of you can be active, but sometimes there's also too much activity or the wrong activity. So I don't know, could it be the tear that's the symptomatic issue? Yeah, absolutely. Might it also not be that? Yeah, that's also a potential. And based on the information that I know now, I can't really comment on if it is the tear or if it's not the tear. So I think it's important to, again, get that assessed properly. And same thing, if you're interested, come see me for an assessment. We can go through everything, and then I can give you my opinion on what I think is the pain generating structure, because that's a big thing. Pain. What is the pain generating structure? You can get an X-ray diagnosis, an MRI diagnosis, all those things. That may not necessarily be the pain generating structure.
Paul, that number, 1-855-55 Dr. Lou, DRLOU, and info@paincarecanada.com. More of your phone calls, 416-870-6400, star 640 on sale right till 12 o'clock this afternoon. On the Dr. Payne Show, Global News Radio, 640 Toronto. It is 11:45. Still got some time, some room for your phone calls. You have questions, complaints, queries about your health. That is why we do the show. And up next, Laurel. Hello there.
Hi. Thank you for taking my call.
Sure.
So I've been experiencing pain in my right knee, I guess, to the lateral aspect of the knee, the outer part. And I only experience it when I'm doing squatting exercises, or even if I should squat. So when I walk, I'm okay. I can even run a bit on the treadmill and it's okay. But sometimes, every now and then, going downstairs or going upstairs may aggravate it. And as I said, squatting is a no-no. I can't do that.
Okay.
So I guess I'm just wondering what I have not had it investigated because it is fairly recent.
Yeah, that's the best time to get it investigated.
So what am I looking at, and what am I? What's the recommendation? Am I asking for an X-ray? What?
No. So okay. Here's a big thing. You don't want to go in excuse me. You don't want to go in asking for things. You want to go into a professional. Number one, a professional that knows what they're doing with the knee. So this is the issue now. I work with a lot of family doctors. I work with a lot of walk-in doctors. Are they necessarily the best people to properly assess a knee? I don't want to say no, but I also don't want to say yes. So because there are some doctors that are very well versed in orthopedics, but I think you need to get it assessed properly, because in getting it assessed properly, you can get it treated properly. When we have doctors Brugava and Gordon on, who are both knee surgeons, they both talk about often how useless a lot of the images and the ultrasounds are when they're not needed. Now, that doesn't mean that they're never needed, but I think the default for a lot of people, a lot of professionals that don't necessarily understand the knee fully. And when I say don't understand, we have to remember a walk-in doctor, a family doctor, their job is your overall health. And really it's a matter of, when do you push it to someone who's more specialized? And to just order X-rays, ultrasounds, the problem with that stuff, and it takes me back to what I was going to say before, is you can see something on an X-ray, right? That they'll come back and they'll say, oh, you've got some mild osteoarthritis in here. Like there's a little bit of wear and tear. That may not necessarily be what is generating the pain. Then you believe you have arthritis and you walk around saying, oh, I've got pain because I've got arthritis. Right. You go do some research and you think, oh, I need to take glucosamine and I need to do this because that's what what I should do with arthritis. But all you're doing is maybe not treating it the proper way, because if the diagnosis is really something else and you're intervening with the treatment intervention for osteoarthritis, then you're not really intervening, right? So it's very, very important to figure out what is the pain-generating structure, and physical problems require physical exams. And so, give me a call when we're off air. I can assess it. I can set you up with someone else if you want to be closer to home, whatever. But I think you need to see the right person and get it investigated the right way.
Okay, appreciate that. And I guess you'll give your numbers.
Yep, Johnny.
Yep, I got it for you, Laura. That number is 1-855-55 Dr. Lou, DRLOU. Again, 1-855-55 Dr. Lou. I know.
DRLOU.
Yeah, I could forget you, but I have to be with you every week. Hey, Barbara. Good morning.
Good morning, doctor. And how are you today?
Good. How are you?
I have been better.
Yeah. Most people don't come see me or call me if they're perfectly fine.
That's very
Even though I think I'm a nice person, I think people should come see me anyways. But anyhow.
Well, there you go. If you weren't an hour and a half drive from me, I probably would have.
Where are you calling from?
Now.
Where are you calling from?
I'm calling from Trenton area, actually.
Okay.
A little town called Frankfurt.
Oh, okay. So that is right. I was like, where is that? Trenton area. Beautiful area. What's your question?
Yeah. Actually, I have a number of things going on. I have fibromyalgia, and I have some disc problems and things like that. But my family doctor, unfortunately, does not believe in fibromyalgia.
Okay.
So he sent me years ago to a couple of specialists in Kingston, and they confirmed, put me on Cymbalta, and of course he filled the prescriptions. But I'm the type of person who is on something for a while, and then it's like I build an immunity.
That's not just you, that's everybody.
Yeah.
Adaptation is our job as humans.
Right. So anyway, I was there a week ago yesterday, and I asked him for something else for the fibromyalgia, and unfortunately his answer was, I'm sorry, there's nothing I can give you. And I thought, now come on, you're a doctor. You know that there is, but you just don't believe in it, so you won't do it. And I was just wondering if there was anything that you could recommend that I might get a hold of someone down here that could prescribe it for me.
So I mean, I think when it comes to the medication, I think one of the things to potentially do, and people will often go back to their physicians for this, but people that are much more educated on that specific topic would be a pharmacist. And pharmacists tend to do what's called compounding, which is potentially different, a combination of different drugs to create something. So now they can't prescribe it, but what you can do is go talk to your pharmacist, let them know, here's what I'm on. I'm not getting any more improvement. Is there potentially something else that I could be using, or some type of compounded, medication that I could be using that could give me an added advantage with minimizing the side effect? They may have lots of things that they can suggest to you. You can then go back to your doctor and say, hey, listen, I've spoken to my pharmacist. Here's what they've potentially recommended. Can you help me out? If your doctor then at that point says no, I mean, then that's a different question, because, I would want to know, well, what is your justification for saying no? You can say you don't believe in something, but I mean, fibromyalgia, the word itself, like I'm sometimes skeptical about like the term around it, but the reality is all it means is chronic pain. Chronic pain is not fake. That's not fake, and anybody that says that that's fake, is out of their doctor. Yeah, they're in my opinion, they're a little loony. Like you cannot deny that chronic pain exists, and maybe we don't have to call it fibromyalgia or whatever, but chronic pain exists, and if you have chronic pain, then so that would be my suggestion to you. The other thing to maybe consider is medical cannabis, medical marijuana. For that type of stuff. So give me a call off air, and then we can point you in the right direction.
Thanks, Barbara. 1-855-55 Dr. Lou, DRLOU. We'll come back. A few more minutes to go. The phone calls 416-870-6400 *640 on your cell. Dr. Payne Show, Global News Radio, 640 Toronto. Last few moments of the Dr. Payne Show here. We'll get to as many calls as we can. Got to Anna. Hi, Anna. Quickly, what's going on?
I've been on prednisone for a year, January 13th, 2017.
Yep.
And I just finished February 2nd, and as I was being tapered off for my autoimmune hepatitis and PBC, I noticed that my body starts feeling aches and pains, but my hands and my feet are the worst, where I can't bend my fingers.
Right.
I'm having snapping feeling, like as if elastics are snapping.
Right.
Snapping. I never had this prior to going on this medicine.
Mm-hmm.
And my liver specialist thinks it's all in my head. They think it's, I'm creating this out of my own brain because I never wanted to go on to this medication, but I did. I followed the instructions. I did whatever they told me to do.
What's the question, Anna?
So I'm wondering is, like when I say, does this not, like, people I've talked to say this is normal, this is what happens when you're on such a crazy drug like prednisone?
Yeah, I mean, it's a long-term use of a steroid. It's. I mean, the other thing that a steroid does is it essentially blocks pain. Like, if we could use steroids and not have any side effects with them, they're probably one of the best things for a pain block. So, it could be a combination of you used it, you came off of it, and now you're feeling more symptoms because you weren't really feeling much when you were on such a strong medication. Could a component of it be psychological, where because you're overthinking it, that your mind helps to contribute to that? That's what chronic pain is. That when doctors try to explain that, I just think they do a poor job of explaining how the mind works, because so many people think that means that the doctor's saying that they're crazy or they're creating. It's not that simple, but the mind does control your pain level. So, I mean, I can't comment for sure if that's the cause. Is it potentially the cause that you came off the medication and it's creating that? Potentially, yeah. I would say that's a discussion that you have to continue having with your doctors.
Yeah, but the specialist thinks that I should be on this drug forever. And it's like, well, I never had this pain prior to being diagnosed with this disease.
Right, but you never had the disease before either, right? So, I mean, that's why you go on that's what autoimmune things can cause, is this type of pain syndrome.
So I don't want to go back onto the medication because psychologically, like insomnia, weight gain, like it's one of the worst drugs I've ever had to deal with.
Yeah, I mean, and again, this is what you have to have the discussion with the specialist who's put you on that. Everything has a risk. Everything has a benefit. What you have to do is weigh what outweighs what for what you have, and that's the job that you and your doctor have to do together.
Busy show.
There it is. Guy, I see there's about 3 or 4 callers still on the line. We're going to have to cut apparently they're kicking me off the air at 12 o'clock. Give me a call, 1-855-55-DRLOU. With your questions, we can, anytime someone wants to call, that is the number. Leave me a message. I'm going to call you back, and we'll continue having this type of discussion.
And info@paincarecanada.com for email as well. Get that consultation happening. Till next time, Dr. Pain Show right here, Global News Radio, 640 Toronto.